Cailin. I'm the CEO and co-founder of HiCura Medical Private Limited. I have a PhD in electrical engineering, specializing in medical innovation. I was an electrical engineer by training, so I graduated from NUS many years ago. So you can guess my age now. But yes, then after that, I was an engineer at Micron Semiconductor, a product engineer. So we were working on memory chips, DRAMs, and right now is more of it's a chip industry lah. So silicon chip industry. So I was an engineer there, and then I moved to IMDA, the Infocom Media Authority of Singapore, as a manager to deal with the next gen NBN network. So at that time, Singapore was just starting out on this journey for the fiber, to install the fiber network in Singapore. And so our team helped to evaluate the proposals and then to set up, talk with the different companies in Singapore to help develop this project, and also to drive adoption of internet access in Singapore. So we were talking to innovative companies to have their solutions in Singapore so that we have more innovative products and services that Singaporeans can enjoy. I left IMDA and started a family, so now I have 2 young boys. I found out that I had cancer, colon cancer, in 2014, and so that has changed my perception on life a little bit more. I was thinking to do a little bit more for the world, to change the world in any small steps that I can take. And what better to do it than to take up a PhD. And because of my cancer, I was very interested in medical innovation. I wanted to translate some of these very good medical innovations that came out of the universities to benefit patients like me. And so I went to take a PhD in electrical engineering, specializing in medical innovations from NUS. I started my PhD in NUS under Prof. Tan. He has many medical projects under his, so that's why I took up a PhD under him. One of the medical innovations was a ear surgical device to treat otitis media with effusion in children. That's when there's a lot of fluid built up behind the eardrum. And so what we did was that we invented a surgical device that would make a small hole in the eardrum of the kid to let the fluid behind the eardrum leak out, and to insert a small little grommet or ventilation tube to allow the air to go in and to dry up the fluid behind the eardrum. The medical innovations that we invented is a small surgical device that would make a hole and insert the ventilation tube in under 1 second. And so this would reduce the time taken for the procedure, and hence we are able to convert a procedure that is typically done in the operating theatre under general anesthesia to something that could be done in the doctor's office that could take just minutes to do. And so we reduce the need for general anesthesia and convert it to a local anesthesia. And as you know, general anesthesia could have some complications, especially for the young kids. And so by reducing it, we improve the patient safety. So that was my PhD. It was a lot of fun. So I deal with a lot of robotics. We do mechanical design, and then we analyze the actuators, different actuators. So what is the control element that's needed to get a very precise action. It was very fun. I would encourage anyone to take up robotics as well. You get to build hands-on actuators. You get to build your own project, and you get the satisfaction of actually, when you build the project, you get the satisfaction of actually seeing it work. And it's something that would benefit a lot of people, for in my case, when it's a medical innovation. So after I graduated from my PhD, like I said, Prof. Tan has many medical projects. And one of them is AI ultrasound guidance software to improve epidural. So I have 2 young kids, right? But my experience with giving birth was not great. I had trouble with my second child. It was a cesarean, and I needed to go through epidural for my cesarean. The anesthetist then took multiple attempts to put in the needle for my spinal anesthesia. And so I was in pain and distress, and then I was in a lot of anxiety because I thought the doctors, I was not in good hands basically. The doctors didn't know what they were doing, and why do I need multiple punctures to relieve my pain, right? So when my professor had this project, he offered me the chance to be on the project, and I took it up immediately because of my own personal experience. And this also ties back with my ambition because I wanted to do medical innovation because I wanted to help patients. And so what's more to do than to actually help patients whom I've experienced the same thing. So the medical project that we are working on is called USign, and the pain points that we are solving is multiple needle punctures. Surprised to know that 6 out of 10 women who is undergoing epidural like myself requires multiple needle punctures for a successful epidural to relieve the pain during childbirth. And not just for women in labor, 7 in 10 seniors who is undergoing hip or knee replacement surgery requires a spinal anesthesia, and 7 out of 10 of them would have multiple needle punctures. And even for kids as well, who has to undergo lumbar puncture for disease diagnosis, for unexplained fever like meningitis, they'll have to go through a lumbar puncture, and many of these lumbar punctures requires multiple punctures. A spinal injection is one of the more challenging procedures that anesthesiologists will have to go through. So what happens is that they will have to put a needle in between the L3, L4 spinal segment. So if you look at the spine, this would be the sacrum, which is near the tail, the hip area, and these are the spinal segments. So the needle would have to go through in between the two bones into the epidural space. And so you can see the spinal structures covered by skin. You won't be able to know where the needle is going in, and only a small gap for the needle to go through. So there are several things that's important here. The first thing is that the level of where the doctor is putting the needle must be right. So the optimal level is between the L3, L4. So I'll orientate you. This is the sacrum. This is L5, L4, L3, L2, and L1. So if the needle is put up too high, the spinal cord usually ends around the L1, L2 area. There's a chance that the needle might puncture and go into and damage the nerve inside the spinal cord area. And so we want to absolutely avoid that because it may lead to permanent paralysis. But if the doctor wants to be very safe and go down a few more levels, it's not recommended as well, because then the nerves at the intended area will not be blocked. So the women will still feel pain basically. The anesthesia is ineffective. And so the optimal area is between the L3 and L4 in the spinal segment here. So that's the level. The other thing that's important here is the angle of needle insertion. So you can see that there's some slight angulation of the bones here. And so if the needle didn't go in at the right direction, according to this angle, if the needle is going in this way, it will hit the bone and it will not be able to proceed into the epidural space. And so the doctors will need to go in at this exact angle of the spinal segment. So this is difficult. We are able to see it here because it's exposed, but can you imagine a patient's back that you can't see anything? So the doctors will have to do a lot of try and error to get to the right angle. And this angle is typically may be different for different people. So the doctors right now, how they are doing the spinal injections is that they're using their fingers to feel the bones. So they're using palpation, landmarks, and then they will feel the different spinal segments, and then they'll be able to know where's the midline and where is they will be able to put the needle in at the L3, L4 level. But there are some difficult patients. For example, patients who are a little bit more heavier. There's more layers of fats. So when you are trying to feel the bone, sometimes you won't be able to feel anything. And that's where the challenge comes. So if you're not able to feel anything, how would you know where to put the needle? So what our technology is doing is to help doctors to use ultrasound to actually scan the spinal structures of the back of the patient. And from the ultrasound images, you'll be able to see all the bony structures. And that's where we can use our AI algorithm to automatically identify what are these spinal structures, and then we will display it for the doctors and guide them to find the right L3, L4 interspinal location and the right angle to put in the needle. And by doing so, we'll increase the first needle attempt success rate, which means that now the doctors would just need one attempt to put in the needle for effective anesthesia. So there are different skill sets that's required for entrepreneur versus an engineer. For engineer, you just have to be in the lab, build things, try and error a little bit, do some programming, and then everything will be, you're an engineer, you know what you need to do. But when you step out to the entrepreneur world, when you try to actually sell the product, you need different kind of skill sets. You need to know how to market, you need to know how to do your financials, you need to know about regulatory because HiCura is a medical device, you have to go through regulatory approval. So you need to know a lot of all these other things. And so what I've learned is that it's better to have someone helping you. So HiCura was involved in several accelerators to help me build up my skill sets required to be an entrepreneur. We were involved with NUS GRIP program. They have short courses on what are the different aspects of being an entrepreneur, what you have to go through. We were involved with Jumpstart. It's a MedTech accelerator program, especially for research that's coming out of Singapore universities. And we were also involved with MedTech Actuator. It's an Australian-based accelerator for MedTech, for medical technology as well. And they helped me to understand the Australian market a little bit more to prepare HiCura for market expansion overseas. I'm very passionate about research translation because I feel that the research shouldn't stay in the lab. It shouldn't stay in the universities or inside the drawer, or you publish research paper and then you don't really actually commercialize it. So it doesn't have any potential to help people. So that's why I co-founded a company with the intention of commercializing the HiCura technology. But of course, it's not easy being an engineer to become an entrepreneur. There are a lot of challenges along the ways, and the same challenges that all the entrepreneurs would face is really to pitch for funds. So when we first started out, we don't really have a lot of money, right? So we put in a little bit of our own money, we got some grants, but we definitely need to pitch in to get more funding from investors. Getting money from other people is not like getting pocket money from your parents, because you just need to put your hand out and then maybe they will just give it to you. But then you have to answer a lot of questions like, how are you going to use the money? What is the traction that you will gain from using my money? What is the milestones that you will meet? And really, what do you plan to do in the future? How are you going to make use of my money to expand and grow your company? So there's a lot of all these questions. We have to convince the investors that our technology works. And different from the other kind of startups, because we are in the MedTech space, there are a lot more considerations as well. For example, regulatory. So for a medical device, you have to go through regulatory approval before you can actually sell it in the market. And so our runway, the amount of time that the technology is working to actually selling it is a little bit longer because we have a different segment called regulatory approval in the middle of it. So it has to clear regulatory approval before we sell. This makes our runway a little bit longer, and hence you have to ask for more money from the investors. And there is a lot of risk. So this is definitely one of the challenge of being an entrepreneur. I remember when I was studying engineering in universities, I had a lot more male classmates than females. I think the ratio is about 7:3. But I think females have an advantage when doing engineering projects because we are more detail orientated, and details is what is important in an engineering project. So I've enjoyed a rewarding career in engineering, and I hope you can join me in the world of female entrepreneurs. HiCura is a patented ultrasound guidance software that uses machine learning algorithm to identify spinal landmarks automatically. And here is a video demo of how HiCura works. Once the doctor puts the probe on the back, HiCura starts to automatically label the spinal landmarks. And all that the doctor needs to do is to move the probe upwards until the dotted yellow line is aligned with the blue line. The doctor then marks this line with a surgical marker on the patient's back. This is the L3, L4 interspinal space. He then rotates the probe 90 degrees and moves it slightly left and right to match the two lines again to get to the midline. He then tilts the probe to find the right angle until the epidural space is seen, and we will automatically measure and display the epidural depth. The cross point is where the needle should be inserted and at the same angle of the probe.